Knowing I will never carry my own children, that was kind of hard to deal with. And I think people say to you, oh, don't worry, I hated being pregnant. And I'm like, yeah, but you got the choice. That choice was taken away from me. Yeah.
Beck Kalpakoff's path to becoming a mum took an unexpected turn. She needed to use an overseas surrogate to have her twins.
Oh, that's clever.
Beck developed Ashermans syndrome after she had a procedure called a D&C after a miscarriage. She was told she'd be unable to get pregnant.
I was very angry when I got the news.
A dilation and curettage, or D&C, is sometimes performed after a miscarriage or after birth if some of the placenta is retained. The surgical removal of tissue is generally considered very safe, but if a complication occurs, especially after a repeat procedure, it can lead to scar tissue inside the uterus, known as Asherman syndrome.
Ashman syndrome will prevent implantation, so women do not get pregnant again. It will possibly increase the incidence of miscarriages.
While it's considered uncommon, affecting 1 or 2 women per 1,000, experts say it's underdiagnosed. Ashermans can be addressed if treated correctly.
The overall pregnancy rate after proper treatment is 87%, which is quite reasonable.
But those unable to be successfully treated have shared stories of loss and heartbreak.
There is not one day that goes by that I don't grieve for the baby that I so desperately want, but cannot have.
I battle with depression, anxiety, and PTSD.
We lost a baby and my body reminds me every month of the damage that's been caused.
I wish I was more informed of the risks.
We've seen many women that, you know, they might have hoped to have a child and then they don't, or they might have hoped to have multiple children and they don't, or they might have pictured a life without chronic pain and they've got that.
Naomi Kate was diagnosed with Ashermans after a D&C following the birth of her first child. She was also told to consider surrogacy.
It was an absolute shock.
After being treated by Professor Van Kai, she was able to have a second child.
Hi, how are you?
Hey Kim, good, how are you?
Now she's working with other women across the country, pushing for change.
To make sure that we raise those stories and give women that platform to share the realities of what they've been through and try to prevent the heartache that we've seen in this group of women.
Advocates are calling for alternatives to D&Cs to be considered. If a D&C is needed, they say an ultrasound should be used for guidance and informed consent should be mandatory. After years of effort, their grassroots campaign is finally gaining some traction. The College of Obstetricians and Gynecologists says it will start by reviewing guidelines around the management of miscarriage.
We're very keen to engage and to do what we can to improve, hopefully prevent it happening in the first place, improve diagnosis.
Beck Kalpakoff hopes any changes go far enough so others don't have to go through the same hardships she did to become a mum.
They just bring us so much joy. And I think too, that's why I want other women to experience this joy because, it's like nothing else.